This morning, the Nigeria Center for Disease Control, Ncdc, confirmed the country's first 2 cases of the Omicron COVID-19 variant, also known as the B11529 lineage. The Ncdc said the variant was discovered following the genomic sequencing of positive cases from routine day 2 tests for all travelers to Nigeria. The sequencing, the Ncdc added, identified 2 cases of the Omicron variant among travelers from South Africa who arrived in Nigeria in the last week. The Ncdc further revealed that retrospective sequencing of previously confirmed cases among travelers to Nigeria also identified the Omicron variant among the sample collected in October 2021. It noted that though the 2 recent cases were asymptomatic, they had been linked to clinical care and other response activities, including contact tracing. The Ncdc went on to state that it assumes that the Omicron variant is widespread globally, with possible community transmission ongoing in Nigeria. Well, joining us now from Abuja to discuss the public health response measures being taken to contain the spread of the Omicron variant in the country is Dr. Ifedayo Adetifa, Director General of the Nigerian Center for Disease Control. Good morning, Dr. Adetifa, and thank you for joining us.
Good morning. It's a pleasure to be here.
Well, thank you very much. Well, your agency released a statement indicating that we now have recorded cases of the Omicron variant in Nigeria, contrary to what was said 24 hours with great confidence that there was no Omicron variant in Nigeria. Well, going forward, what steps is the Nigerian government taking, and particularly your agency, the Nigerian Center for Disease Control?
Thank you very much, Dr. Abati.
Yes, go ahead. I ask you a question. What next steps are we taking as a country, and particularly your agency in collaboration with other stakeholders, particularly at the subnational level, to address this new discovery?
Okay.
Yes.
All right. Thank you very much for your question. Yes, 24 hours before, we said with great confidence that there were no Omicron variants in the country, and that was correct because that was based on the state of results at the time. As you know, surveillance is an ongoing activity, and we continue to generate results from the lab, from tests, both for just case identification and sequencing on a daily basis. So the update today is correct for at the time that the press release was issued. And as we indicate in that press release, it will not be surprising if we find more cases as we continue to sequence all of the samples that continue to accrue. And this is reflective of the situation worldwide. As you know, by the minute, the number of countries that are reporting this variant continues to increase. Now, in terms of the measures that we have in place, we continue to enhance surveillance as is recommended at this time. Countries are required to conduct a risk-based assessment of transmission, and we are enhancing surveillance in terms of looking at travelers and likely importation of cases, and ensuring that travelers adhere to all of the travel advisory regarding day 2 testing and day 7 testing for the appropriate category. As you are aware, the PSC has changed the travel advisory, first of all, to reduce the window within which PCR tests need to be done pre-departure. We have made day 2 tests compulsory for everybody regardless of vaccination status. And in addition to the day 2 testing, those that are unvaccinated will have a day 7 test. In addition, we are prioritizing sequencing as recommended for all incoming travelers. And we are not focusing on South Africa or Southern African countries like everybody seems to be attracted to. What we anticipate is that this variant is everywhere. So we will give the same attention to all travelers coming into the country and all samples that are positive for for COVID. In addition, the treatment centers across the country are still there, oxygen plants, oxygen supply, to take care of any potential increase in case numbers requiring hospitalization. This remains a theoretical risk, as we know from emerging data everywhere, especially in South Africa and even the cases identified in the Netherlands. Most cases with this variant have been asymptomatic or mildly symptomatic. We've not recorded any fatalities, but we continue to watch as this variant spreads through the population and maybe identifies pockets of high-risk groups or susceptible groups. For the specific cases that have been identified and will be identified, standard contact tracing, isolation, testing, connection to care, and all of the other relevant measures as stipulated in the guidelines will continue to be implemented. That there's a new variant does not really change what we do. It doesn't change the effectiveness of the public health measures as recommended. It doesn't change the requirement for vaccination or the benefits that are likely to accrue from vaccination, regardless of what the variant does. Over.
So far, so sanguine. Are you contemplating a travel ban at this point in time?
The decision about travel bans is not made by the Ncdc, but at this moment, we will, from a technical perspective, not recommend a travel ban. We are currently the subject of travel bans ourselves for reasons that are not driven by the science. And as we know, recent information from the Netherlands show that they actually identified a case or cases of this variant well before the South Africans did. But the South Africans and Southern African countries are currently, and Nigeria now, for some country destinations, are currently the subject of travel bans. This is not driven by the science, and this is, we think, from a technical perspective at the moment, that this is not the way to go at the moment. What we need is enhanced surveillance, enhanced vigilance. We need our populations to adhere to recommended safety measures. Remember that the Canadian authorities reported that there are Nigerians who arrived in their territory who subsequently tested for this virus. So who are we banning? Are we going to ban Nigerians from traveling and exporting these variants to other countries, or are we going to focus, we think it will be easier to focus on banning people from other countries. And now, at the last count, 22 plus countries had reported this variant. So where will the banning end if you start?
Which I imagine is why,
Over.
precisely why your focus is a lot broader than Southern African countries, in contrast to the pseudo-scientific approach some other countries have taken. But I want to go back to what you said, that yes, NCDC does not impose travel bans, but is it in your advisory capacity to do so? Let's talk about how Nigeria could decide to impose a travel ban on some countries. Is it a scientific process or a political one?
From the perspective of the NCDC, we give technical advice, and this is based on risk assessments of transmission, the transmission risk from countries where intending travelers are coming from. So, as recommended, if you follow a science-driven process, you review the epidemiological situation in those countries, you review the genomic surveillance data in those countries, and then you make a decision based on the risk of importation and the risk of transmission should importation happen to the country. And we give a technical recommendation, for example, to the principals in the Ministry of Health and to the PSC. Along the line, there might be other considerations, politics and all of that, but we provide technical advice based on the science as we see it and as we understand it.
Okay, thank you so much, sir. So confirm this for
Back
me.
to you. Yeah.
There was a story about a certain sequencing where the strain of the Omicron was seen prior to this time. Can you confirm that story for me? And secondly, what will be, the push as regards sensitization for December? Thirdly, what is going on with the data collection mechanism for the NCDC and collection of reports of COVID-19 cases in the country? Because a lot of people suspect there's been a lull in that. And why is that we're having delays? Some days you have delays from 2-3 days prior. What's the cohesive mechanism with the states? Did you hear me, sir?
Okay, so
Yes, sir.
yes. So before the announcement of the variants, emergence of these variants and all of the news and worry that has followed that, the NCDC was already in the process of implementing plans in preparation for the Yuletide and the associated travel in the month of December and January, and that will continue. And that will be rolled out even more quickly now that we have the news of this emerging variant. So that sensitization, that to the public, to state authorities, to port of entry authorities, within and out of the NCDC, with partners in the Ministry of Health and elsewhere, is already in the works and will be rolled out even more speedily. In terms of what's going on with the NCDC data collection, I'm not sure how to respond to that, but as you know, we collect in the interest of the transparency and openness that the NCDC has adopted along with the PSC even well before I assumed office. We continue to collect data from states who are required to report to the central repository on a daily basis of case numbers that we report. Now, what sometimes happens, obviously, is these reports are transmitted electronically. So sometimes there are connection issues. The reports don't arrive in time for collation for our reporting. And this is why you see the subsequent adjustments that are made in subsequent reports. Sometimes case numbers and even deaths come as a backlog because there were challenges with transmission or with records. But we eventually report all of that. What we have seen, again, in the past weeks, obviously, as part of a feature of pandemic fatigue and similar to what's been reported everywhere else, is that there's been a drop in testing for a few weeks before the last one. But we've seen an uptick in testing as a result of all of the efforts put into place to try and get states and people who are on the front line to return to testing. It's also gone up in response to our interventions and continued rollout of rapid diagnostic tests to make these tests more accessible, more readily available, and easier to do than the reference test, which is PCR. We will continue to do that over the coming weeks. In fact, we are in the process of consolidating testing guidelines. We're preparing for a massive rollout of rapid diagnostic tests as a means of shoring up and ensuring completeness of surveillance. These activities were already in the works before even the variant. The variant doesn't change the way you do surveillance. Yes, it means that you may need to pay more attention and find a way of triaging which samples to sequence depending on the test you have done, but the back process does not really change. Back to you.
Well, you made specific recommendations in the statement announcing, the detection of the Omicron variant in Nigeria. Recommendations to states in terms of how to prevent community transmission by doing more testing, antigen rapid test, and then to individuals specifically, what kind of precautions individuals should take. Those were the two major paragraphs in the concluding parts of that statement. Well, is the NCDC going to take further steps to engage the states or to engage with certain other stakeholders in Nigeria to amplify the recommendations to individuals in particular, or that is beyond the mandate of your agency?
Thank you, Dr. Abati, for the question. As you know, there are a lot more activities that are going on. Some of those include these engagements that we are currently in the advent of following the release of the report. We have engaged the press, who have been very good partners of the Ncdc in the pandemic response, and continue to be our valuable collaborators for the work that we do in general, whether COVID-related or not. So we will continue that engagement. Our risk communication leads and experts are working overtime to engage our usual partners and stakeholders. As you are aware, there's a National Council of Health meeting going on in Abuja. We have the opportunity again to engage with our honorable commissioners of health in respective states. We are engaging with governors through the Governors Forum and, of course, through the National Economic Council meetings. And we continue to also engage with all of our other partners who are helping, are providing support in terms of testing, in terms of sensitization, in terms of lab work, in terms of sample referral and all of that. And if we put on paper a description of all of the other downstream activities, for want of a better description, obviously that press release then will become a handbook and not a short press release as it is. Back to you.
Let's talk about the role of vaccination in this, in this fight against COVID-19, and specifically this new variant, the Omicron variant. Data from the NPHCDA as of 29th of November showing the top performing states with regards to vaccination. Ogun State, 3.3% of the target population has been vaccinated. That is a long way off from the 50% aim by the end of January 2022. What is your comment on that?
Well, I think there's been, great progress. It might, obviously, 3.3% when compared to the target of 50% seems quite distant, but you also, in your journey across life or trajectory for particular events, it's also important to look at where you're coming from. So yes, there have been substantial gains compared to where we started from, but we have to remember that the scaling up of vaccination and these mass campaigns was only flagged off a little more than a week ago. So some states are actually moving very quickly and making great progress. And what we hope to do, and I'm sure my colleague in MPHCDA will echo this, is that the states continue with this trajectory, or even a much steeper trajectory in vaccine uptake, so that we can come closer to the targets that has been set for the period. Now, it is important to highlight to fellow citizens that unmitigated transmission of this virus is what leads to emergence of variants. We are all worried about Omicron now because of the theoretical risk of increased transmissibility, increased severity of disease, or possible vaccine escape. We need to remember that variants emerge all the time. Not too long ago, we had the Eta variant, which also was associated with Nigeria in some respects, because a few cases arriving in I think it was in Denmark or somewhere else, were actually people with travel history to Nigeria. So variants will continue to emerge. So far, we may say that we have been lucky, because we've not had a variant that has substantially changed the landscape of this disease for Africa, for Nigeria, the way it has in terms of severity of disease and deaths are seen elsewhere. But that risk remains, and that risk will persist if we do not do the things that we need to do to prevent transmission. And one key thing is to just get vaccinated. Vaccines prevent transmission. They reduce transmission if infection should occur. They protect against severe disease and deaths. In the press conference, the last PSC press conference, I highlighted how all of the deaths, almost all of the deaths in the last 2 months under review occurred in people who are unvaccinated. So vaccines have a benefit, and I hope that with you, with other partners in the media, with civil society organizations and the like, and everybody else who has a stake in this, we will continue to sensitize our fellow citizens to really make use of every opportunity that they have to get vaccinated. You can see, as you described earlier, that even in response to these variants, some other countries or territories are ramping up booster doses. They are ramping up booster doses, they are vaccinating younger people, and all of this actually just points to the fact that there are benefits from vaccination, and we should make use of them while they are freely available. Prevention, as they say, is better than cure. Back to you.
Thank you so much. This time last year, we thought we're out of the woods until this Yuletide period, cases increased and we had the surge all of a sudden. Then we had to reopen those isolation centers. Is it time to start looking at the state of those isolation centers again and getting them ready in case cases will surge? And secondly, I'd like to know more about the data collection mechanism, because a lot of people still question, that data collection mechanism. Can we say for certain that the over 200,000 cases are the over 200,000 cases we've had of COVID in Nigeria? Can we interrogate that data set even more? And thirdly, the state of the labs that do this test for people that come into the country. In fact, we've heard stories of people just buying results, negative and all of that. What can we do to stop all of that, to bring more integrity to the system?
All right, thank you for that question. Obviously, we know that the tests that are reported or case numbers reported by the Ncdc are indeed the cases that are reported. But we know, because of the characteristics of this virus, that whether it's here or elsewhere, the case numbers are actually underreported. When you have a condition that is largely asymptomatic among populations, then it's difficult to ensure 100% testing, because people will, there's no basis, no indication for testing. Unless, of course, if you're asymptomatic and you're a recent contact of a known case, then you may get tested as part of case contact tracing procedures. But otherwise, with widespread community transmission and most people not having symptoms, we know from, and this is backed up by the antibody surveys that have been done, that our case numbers are underreported. And this is not unique to Nigeria by any means, okay? We know there are areas to improve. We really would like to increase our testing per capita to ensure that we do enough to help us to have a complete picture of the epidemiology of this virus in the community, and of course to get samples that help us ensure completeness of genomic surveillance. Now, speaking about laboratories doing tests, and maybe people purchasing tests and all of that. Well, again, not to use this as an excuse, but we know that there are fake tests, fake vaccine records, cartels or criminal groups operating across the world, not just in Nigeria. Interventions are put into place. Once you block one loophole, these people, instead of applying their ingenuity elsewhere, of course, find new ways to try and evade the system. But as mentioned by the SGF at the last PSC briefing, we are cracking down on these groups as soon as we find them. There are lots of people, lots of even staff in the airports from agencies and some of the laboratories that we've identified to be involved in this that are currently subject to investigation and being followed up by the DSS, and some people being prosecuted even in mobile courts that exist in Lagos, for example. So there's an ongoing process to maintain the sanctity of the system and to pick out those who try to not adhere to the travel advisory. In terms of the data, obviously, we have a system where we try to ensure that every test that is done, whether rapid or PCR, is entered into the digital data collection system and is seen centrally. In fact, what you may find out from the states where, for example, rapid diagnostic kits are currently being rolled out is that we ask and we follow up to ensure that there is reconciliation of test use data with surveillance database data before you restock. So this is one of the measures we put in place just to make sure that we have completeness of data and also to ensure that the data is of the required quality. In terms of data collection, testing, there will continue to be room for improvement, and we will continue to work to close the gap, to make things better, to ensure we've got full coverage countrywide in the coming months, whether there's a new variant or not. Back to you.
Well, very quickly, Dr. Adetifa, you talked about vaccination, and yes, it's the same point being made in other parts of the world. Vaccinate, give the people boosters. Nigeria recently launched a mass vaccination campaign. We have been able to fully vaccinate just about 3.4 million persons out of a target population of 111 million eligible Nigerians. Now, in the face of the Omicron variant and your recommendation that vaccination is important, do we really have enough vaccines to meet the challenge? And how about the challenge of vaccine hesitancy, which would seem to be a major problem in Nigeria? And what do you think of this latest development internationally? The CEO of Moderna saying that there are doubts about whether existing vaccines can tackle the new variant, and that has sent shocks around around the world. Even the markets have responded to that. What do you think in the event that the Omicron variant becomes a real problem in terms of transmissibility and hospitalization? Are we anywhere near prepared?
Yes, that reminds me that there was an earlier question about treatment centers. So treatment centers are still open and running, and in fact, every week, colleagues in the Ministry of Health who are responsible for what we call the case management pillar of the COVID response report on occupancy, report on oxygen demand, report on progress with stocks of oxygen and oxygen supply and newly installed oxygen plants. So the capacity is still there. At the moment, it's relatively underutilized if you, given the number of cases that are available, and will be able to absorb, we hope not, any increase in cases that we may have, just either as a result of this variant, or actually just the increased movement, increased crowding, increased transmission that we anticipate may happen as a result of travel and all of the related events in the Yuletide. As the Executive Secretary of the MPHCDA said at the last PSC conference, and as I know is the case, is there are enough vaccines in town, around, and in the pipeline for supply to take care of all Nigerians willing to be vaccinated up to the target of 50% of the eligible population that we've set. So the previous worries about access, whether there will be vaccines or whether there's access to vaccines, are now unfounded. I mean, there are mass vaccine campaigns going on. There are mobile stations. I mean, here in Abuja, I went to one of the shopping malls recently, and I had to cost to actually say hello and greet the MPHCDA colleagues or FCT colleagues who were sitting in front of that mall to offer both COVID vaccination and indeed even hepatitis B vaccination. So the problem is uptake at the moment, and I'm sure if you speak to the MPHCDA ES, it will say the same thing. We need Nigerians to take up the vaccines that are available, to consume the supply that is available, so that we don't get to a situation where after we've all clamored for vaccine equity and for vaccine stocks to be shared with us, we actually allow vaccines to expire in the freezers and in the cold rooms, and then, God forbid, we have another, maybe virulent variant that takes us back in the pandemic. So that's the situation now. There are enough vaccine doses to cope with the demand that we expect, and the issue we have is of people not sufficiently coming out to ensure that we get these vaccines into the arms. In terms of vaccine hesitancy, this is not a unique problem to Nigeria. It's a big problem with vaccine hesitancy everywhere. And even in places where there were lots of deaths, significant admissions, and even more disruptions to their lives and livelihood, there is vaccine hesitancy. So it is not surprising that there's a bit of that here. But the MPHCDA continues to engage with religious leaders, engage with traditional leaders, engage with civil society, engage with media, and everybody that we need to engage with, that they need to engage with, to ensure that we try and get a buy-in and change the minds of people who are a bit on the undecided side of things in terms of whether they should get vaccinated or not. And we expect that that will change over the coming weeks and months, because if people had not been changing their minds, we will not see the uptick that we are currently seeing in vaccination in some of the states, as you've reported. So we will continue to track that process I'm sure at PSC level, and I'm sure that I know for sure that the MPHCDA continues to report and continues to track what is going on in the field. Back to you.
Well, thank you very much, Dr. Adetifa, Director General, Nigeria Center for Disease Control, for joining us on the morning show.